Again and again, I searched on this. And finally, I accepted that it's true. We learn only, it's the 15% comes from, the 15% of our success comes from hard skills, and 85% comes from the soft skill part of our abilities. You know that in your batch, think about your own BDS final year batch. There may be very studious, brilliant students in your batch. There may be backbenchers, arrear people who have a lot of back papers. But when you look into the practice of your batchmates, those people who have written their oral pathology thrice or twice, or done pharmacology triple times, they are doing a fine practice now. Even the college campus, they had a lot of soft skills. They were skilled in many things, while the brilliant or studious students were very adapted to their own classrooms and books. But these fellows had a lot of curricular, extracurricular activities. It's no matter they had a course lag, but in the practice, they are doing better clinical management than the first rank holders of our batches. Okay, our first rank holders, they are doing very good job. They are having principal posts, they are having research fellowship, doctors are there. Everything is fine. But in management skill, the soft skill is very important. So what is soft skill? It enables people to effectively navigate in their environment. Now we are in a special environment of Corona. Okay, we have to navigate through this special environment effectively, work well with our staff and people and the patients, and we have to perform well, achieve our goals. Okay, in this Corona period, dental surgeons are the high-risk people who are exposed to such patients working in the oral cavity, and we people are suffering a lot of economic problems now. Our gloves have increased the price triple, and all the materials charges have been hiked. But we are in a way that our patient treatment costs cannot be hiked because patients are suffering a lot because of the financial crisis. So we have to manage everything. So the effective navigation through the environment can be achieved only by having a very good soft skill. Okay, so the happiness of our life depends upon the quality of our thoughts. What do you think about dentistry? What do you think about dental practice? That is very important. So every thought of you is a real force. What all things you think is going to convert it to be a force in your life. And your mind is actually shaping the world around you. You are having a family, you are having a community around you, you are having your clinic and patients in practice, but each and every thought which is running in your brain is going to shape the world around you. So if the dental surgeons who are listening to my talk today, they can continue listening. If you want to shape the world around you beautifully and with very excellent mode of professional life. Okay, so there comes the importance of this topic, smile with confidence. Okay, so when we talk about problems, it creates more problems. You may be aware of that. When you watch any TV program, any news channel, or any newspaper front page, they will be highlighting about the problems around us. It is going to create more problems. But talking about solutions create more solutions. We can talk about the problems in dentistry and problems dentists facing after this Corona. We can talk about that hours and hours. But we want solutions. So when you focus on solutions, it is going to create you more solutions. So I don't want to waste my time. I'm straight away going into the solution part of it. So let us go for the solution. I think all of you are ready, and we are jumping into the clinical management side. And I'm going to focus on two things today, which is going to help to improve the quality of your dental practice. At the same time, it is going to improve the quality of your personal and social life. So investing in yourself is the best investment you can make. We have invested a lot in our clinic, our equipments, and a lot of things we have done. But just think about investing in yourself, investing in your skill and abilities. So we have our profession in hand, and one side we have our home and family. The other side we have to take care about our health, and we have to communicate with the society, and we have to integrate all these things in our life to have a successful life. So we always say that we have to balance thing in life. My dear friends, let me correct you. I would like to say that there is nothing like balancing life and work. It is a hectic thing. When you try to balance two things, we have to make the same weight here and there. We have to balance it, right? Your practice and your family life, you have to balance it. It's a struggle. Don't try for that. You have to integrate your professional practice, your profession, your work, and your life. So that is the integration is the only solution for that. So if you integrate things in the right slot, in the right way, in the right time, you're going to be successful. So let us learn how to integrate our work and life intensely. I think that everybody is okay now. Dr. Adina, can you hear me? And the slide is clear. Can you please respond?
Yes, sir.
Okay,
Sorry.
can I go ahead, right?
Yes, yes.
Fine. So, stress. If you have brain, you will have stress. Don't believe that you will have a stress-free life, but you can manage stress in the best way. Okay, so doing a job of a dental surgeon is much easier than managing a dental practice. So practice management needs more skill than doing just a simple cavity filling or doing an orthodontia or exodontia or something like that. If you are going to manage your clinic, it needs more skills. If you are not well equipped with such skills, at the end of the day, you'll be sitting like this or like this. Okay, you'll feel tired, hectic, frustrated, depressed, oppressed, and suppressed. Okay, so Corona, the COVID scenario has given us a lot of learnings in our life. It has changed our life. And we have to look into the positive aspect, what Corona has implanted into our professional and personal life. Of course, when you see the PPE kit, when the persons with PPE, medical professionals with PPE, and the shifting of the patient, which was done so easily in the older days, now every scenario has changed. Health sector has got a new phase now. And fear, anxiety is packed along with this. A lot of phobias are going along with this, coming along with this, Corona. And I don't think that you believe me. I came to know that one medical health professional person who is working in the government sector has suicided day before yesterday. He was very active. He was very active in the community, helping the people all around where he was working. And finally, 2 weeks back, he got positive. He was Corona positive. And after that, he was negative, but there was a depression catching hold of him. He was so depressed, and he's a so nice person, but unfortunately, he suicided 2 days back. And the phobias, the anxiety, and the depression part is also growing along with this new post-corona scenario in the society. We have to be aware about that. You know that everything has changed. The doctor coming into the ward or the room for rounds, and the assistant doctors, the nursing staff, everybody is in full protection, and the things have changed a lot. Even the funeral ceremony, where our life is going to take a twist in our thought and in our activities and rituals, has also changed. We are seeing JCVs in the funeral graveyards. That's a painful situation. Anyhow, stress in our life is going to make a lot of problems. Adrenaline pump happens, and it's going to have affect the cardiac system, pulmonary system, digestive system, the vessels, and the every system is going to affect with this excessive pump of adrenaline in our life. So we have lot of demands in the life, and the conflicting demands between the life roles is going to give stress for you. You are a doctor, you are a father, you are a son, you are a husband, you are a leader, and you have many roles in life. And there will be demands from all these corners of life in front of you. And when there comes the conflicts, you have to manage things there nicely and beautifully and with excellence. And if you have stress, it is going to give you headache, low energy, muscular pains, gastric problem, GIT problem, especially irritable bowel syndromes, insomnia, bronchial issues, grinding of teeth, and palpitation, and things will be there. You know that, everything better than me. And there will be a lot of health problems also. And dental surgeons are people who are suffering from neck pain, back pain, muscle pain, and things like that. So stress is a very important element which has to be attended scientifically so that we can practice well in the clinic and we can smile with confidence. If you are poor in your general health, you cannot practice well. Okay, so you can have coronary artery disease. If you have more stress, the platelet aggregation will be more, clot formation will be more if you have stress. So you know that a lot of dental surgeons all over the country is having cardiac issues now. They are having angioplasties, they are under aspirin. So that's a very important point where we have to put attention that your life is so smooth and nice, even in the midst of all these problems. You can have low back ache if you have stress. You can have headache, as I told you before, APD, upper respiratory tract infections, mental illness, and even latest studies says that cancer can be, stress can be a contributing factor for cancer too. Okay, fine. So coming into the topic of practice management with this introduction, let me talk to you some points where you can take it home today and put it into your practice from tomorrow itself. Or in a better way, from the very next moment when you finish the talk, I hope that all of you are at home today because today is a Sunday. You can apply all these things in your family today and in your clinic tomorrow and get me the results and send me the results so that we can share a lot of things and I can help you if you want some assistance where you feel some hurdles in your life. So as I told, practicing dentistry and managing dentistry is having two dimensions. Practicing dentistry should have a very good scientific knowledge about dentistry and a good hand. But at the same time, managing a dental practice demands a lot of skills from our side. So Amartya Sen has told that poverty is not just lack of money. Everybody is talking about money now because of this economic crisis all over the world. It is not lack of money. It is not having the capability to realize one's potential as a human being. Never think that your life has gone into an end when you became a dentist. A lot of dentists have a lot of other capabilities. You have to exhibit and enjoy all those capabilities which you are having in your life, which you are blessed with. So you have to identify yourself. Here, you're managing capacity. To manage a dental practice, what are capabilities you should have? And it's a very wide topic. I don't have enough time for that, but I'm going to teach you two very important, essential things which will help you to smile with confidence in your life. Okay, fine. So you can't stop the waves, but you can learn to surf. Waves will be there. Now it is the wave of Corona. In our college days in 1986, 89, 90s, we were taught about this AIDS. It was a wave on that time. How to surf through AIDS patients, how to manage them. It's a very, very, very sensitive topic for us. And then we went through a lot of things, and now we are in Corona now. And tomorrow we may be facing some other type of bacterial or viral infections, or some other type of epidemics, or like a practice management about the resource problems, about the financial issues. We may have a lot of waves in our life, family issues. Okay, we cannot stop such waves. It will come. But if you know how to surf through that, it is wonderful. You can go ahead without depressed, frustrated, and suppressed. Okay, the waves may be with different types. Let it be high or low. You learn how to surf, you'll be successful. So the number I told you, I'm going to teach you two things today. The number one is emotional bank account. When I talk about bank account, everybody will be interested to know the balance in your bank account, right? But the topic of the day, the one part is about the emotional bank account. A dental surgeon who is managing a dental practice should be very much aware about the emotional bank account. It's as similar as a regular bank account. You do have bank accounts in the minds of your friends, relatives, family members, and your patients. As the dental council member of your branch, the proud of IDA Kerala, Dr. Biju Nair, who is in your branch, who has introduced me, who is my classmate for BDS, I do have a strong emotional bank account in his mind. He rang me up several days back and told me, Lateef, you have to do a webinar for me on 21st of February. That was a command. I said, yes, sir, because our relationship was like that, is like that. Because the emotional attachment what we have. So let us learn about the transactions and the precautions to be taken in the emotional bank account of your patient, of your staff, of your wife, of your children, and the people around you. You know that you may be classifying some patients walking into your clinic as good patients. Some you term them as irritating patients, right? Don't term them as irritating patients, because they are coming to you again and again. They are your loyal patients. You have to learn how to manage your loyal patients and how important is a loyal patient to your practice. I'll teach you that things in another session. That's another topic of practice management. So emotional bank account. There are two sides. As a real bank, we can deposit and we can withdraw. We can deposit something, we can withdraw also. So the quality of relationship is dependent on which side you have invested more. If you have a strong deposit, no problem, you can withdraw whenever you want. But there is a limit. If you have deposited 10 lakh in your bank, you can withdraw 9 lakhs, no issue. Still there is 1 lakh inside. And if you have deposited 10 lakhs and if you give a check for 20 lakhs, is it possible? Yes, it is possible. You can get it as a loan and you have to pay interest for that, right? And it is going to break your backbone. So, in relationship between the patient, managing your patient is not merely filling and doing procedures in the dental clinic. The first thing you have to attend is to open an account with the patient. Maybe your patient may be coming into the registration counter, doing the registration, giving all the data, everything is fine. But when the patient comes to you Let the patient sit into your consultation table, not on the dental chair. And believe me, nobody can address your talks when they lay down like this in the dental chair. Sit straight and talk to the patient. Let them sit in front of you, talk to the patient, ask about their complaint, look at their eyes, have an eye contact, do all the things you can do beautifully and positively with your muscles of facial expression, and make a good rapport with the patient. Then you go to the practice side. Of course, we are learning such things in pedodontics, but nowhere else in other department we are taught that. Okay, so with each and every gesture and each and every word, you can deposit things in your bank, emotional bank account of your patient. And at the same time, the wrinkles on your forehead or the expression of your facial muscles may withdraw something from their account. If you're not happy with the patient, they can read everything from your face, even if you put a mask. The tone of your voice can be identified by the patient. So try to deposit and withdraw in the emotional bank account of your patient and the people around you. How can you deposit things? Be kind to everyone. Show courtesy to them. Keeping promises, especially appointment. You give appointment for the patient at 10 o'clock. The patient walks into your clinic at 10 o'clock and you call them at 11. It's not right. Okay, keep your promise. And if you have some delay, inform them and apologize for that. And loyalty to the absent, making apologies whenever necessary, as I told you. All these characters, positive characters, which you implement into your practice, is going to deposit something in the minds of the people around you, especially your patient, and more importantly, the people working along with you. Your clinical assistant staff may be working with you for the last 10 years, 20 years. I have my assistant staffs, 2 of them are along with me for the last 20 years. Okay, so the amount of emotional deposit you have made positively in their mind holds this relation, the account strongly. And the same is along with your spouse also. And if you're rude at your staff, if you're rude at your patient, and if you're rude at your spouse and children, it is going to make a withdrawal from the bank. Okay. So if you break promise, that's a withdrawal. If you are disloyal, it is a withdrawal. If you are showing pride, if you're arrogant, it is going to withdraw something from the account. So of course, it's your spouse, your wife, you can shout at her. She forgot to put sugar in the coffee and you started shouting at her. After all, she was busy in bringing about the house and children and kitchen, everything. But in the midst of the busy schedule, she just forgot to put sugar in the coffee. But you started shouting. But instead of that, you can say that, Janna, could you please give me a little bit of sugar? Then she will realize, oh God, I forgot to do that. But my darling is a sweet person. He never scolds me. It's another deposit. You can scold her to any extent you want because it's your wife. Okay? But that is going to withdraw from the bank account which you have opened with your spouse. And if you start withdrawing too much, one day the relationship will break. So having a positive balance in the emotional bank means that you can make withdrawals and still keep relationship and trust between you very strongly. So a positive balance in the emotional bank, with a positive balance, you can speak up even when it is a difficult conversation. You can shout. I used to do that in some situation, not always. When some mistakes is noticed by me, I used to shout at my staff. But at the same time, I always try to make it important that the same day I patch up everything, I do maximum deposit in their emotional bank because I have to make the balance strong. Then only we can move ahead. So what are the six things which is important to make this emotional bank very important? Understand each and every individual. Each and every patient is different. Each and every individual is different. Your wife is different individual. Your kids are different individuals. Okay, attend to little things. Keep commitments. Clarify your expectations. And show personal integrity and apologize sincerely when you make a withdrawal. This you have to learn and practice today itself. Okay? We always blame others for the problems in our life. But take it from me, the problems in our life, the most and foremost responsible person is ourselves. We have to think about that. Don't curse others for the problems in our life. So start the habit of apologizing for the mistakes we have made. Otherwise, days will be turned like this. Qualified persons, beautiful house, wonderful car, everything is nice. But inside story is a little bit smoky, foggy. And if it is going to increase day by day, everything is going to break up. And of course, the kids are going to suffer because of this. If you have a stress at home, if you have stress at your clinic, at your practice, don't carry such stress into your home. And don't pour into your spouse's head. It is going to damage your life. That's what I said. Integration of work and life is very important. And if you continue doing that, it is going to spoil the life of your children. So learn to integrate the things in your professional life and personal life nicely in the right way. So if you make more withdrawals than deposits in your life, you will be out of balance. Naturally, it is like that. Some friends usually ends up with that. They withdraw maximum. They curse their spouse, their subordinates, their junior doctors, their specialists, their assistant, chairside assistants. They curse a lot and they withdraw a lot. And finally, one day, they will be out of balance. And then you see that I lost my practice because of them. I suffer a lot because of them. Don't say that. It is only because of you it happens. So always see that you are not out of balance in the emotional bank account. Make it very strong, very strong. You can try, even just after my talk, go to your house, walk into the kitchen where your wife is preparing your food. Just give a pat on her head and say that, darling, get me a coffee with your hand. And she just looks at you. Is it my husband? Oh my God, a Sunday, 2-hour CD program, a lot of changes happened. I have never heard a beautiful word from my husband for the last 12 years. We will be married for the last 13 years. Only the first year was beautiful. Then everything is smoky. So just try like that to deposit in the minds of the person who is around you. Otherwise, everything will be smoky and foggy and it'll be really tough. Or you can have life like this, West and East. Okay. So the emotional bank account, make deposit by creating and building positive moments with your partner. Life is actually a collection of moments. Make each and every moment beautiful at home and at clinic. Even if you're working on a difficult, narrow canal, doing an endodontic practice, let your mind be so beautiful and happy. You can have a better practice. I'll come to that. So make each and every moment beautiful and do have a strong emotional savings in your life. Like this. This is just an emotional depositing in the emotional bank account of the spouse, even after 70 years of better life. Just think about that. Okay. Then coming into a little bit of science, the brain, we have white matter and gray matter. And the gray matter is the area where the cell bodies are accumulated, and so it have the gray color. And we have the white matter where the neuron cell bodies are connected with the dendrites and axons and things like that. And it is named because of that. And this distinguish, how to distinguish between this gray matter and white matter in the CT scan or MRI, something like that. So you are aware about that. I'm going to tell something about the brain. The gray matter, the density of the gray matter will be affected if you are too stressful. Stress is different type of stress are there. Acute stress, it's necessary in life. Chronic stress, it is to be avoided. Cumulative stress is there. Vicarious stress is, a lot of stress are there. So if you are in a chronic period of stress, from March 24th, 2020, people in India is in a period of chronic stress because of Corona. But we have to come out of that. We have to learn and modify our life because of that. So if you're under chronic stress, it is going to affect the density of your gray matter. It is going to affect the ability of your brain capacity and the capabilities of your brain functioning. So with that, I say that there are a lot of things to be studied about the brain. When stress comes into your life, what happens to the anterior cingulate cortex or the amygdala or to the all other hippocampus areas of the brain, how your self-control is lost, how you are more impulsive in behavior, how your occasional behaving according to each occasion is being lost because of your stress, your memory, your resilience capacity, all these things are brain studies, mainly by Harvard University and Massachusetts University. They have lot of studies on this, how stress is going to affect your life. Okay, we'll talk about that in another scenario where stress management dental practice can be dealt with in another situation. Now I am going to the number 2. I told you 2 points which I have to share with you. One is emotional bank account. So be aware about that. Start depositing in each and every person, positive deposits in each and every person's emotional bank account. That's the number 1 point. So that you can smile with confidence, because you can curse them, you can scold them, you can beat them, but you can smile with confidence. That's according to your relationship. Okay. Then comes the second point, the hormonal influence in dental practice management. We know that we have got a lot of hormones, and how the dental practice management is influenced by certain hormones. How that things can be applied into the day-to-day dental practice. It's a very simple thing, but it do have a little bit theoretical part on that. More than that, we have a lot of practical side on that. And with that point, I'm going to conclude today. So, you know that happy hormones is very important in everybody's life. The happy hormones is, we can put an acronym like this: DOSE, dopamine, oxytocin, serotonin, and endorphin. I request all my friends to go into Google and search more on this, about this DOSE. Learn in depth about these hormones and just correlate its importance in dental practice management. Okay, these are the 4 hormones. I will go into one by one. These hormones, these happy hormones, are chemicals, as you know. If you have experienced changes in your life in appetite, mood swings, energy, self-esteem, anger management, weight management, sex drive, chances are there you are being impacted by these hormones. So believe me that we have 7 days a week, but don't be so focused on Saturday evening, right? We are always more focused on Saturday evening, the relaxation day. A lot of things are waiting for us. It's not a true life. You are going to suppress and ignore many things happening on the 6 days. But be there and be aware of everything and try to manage everything on the same day beautifully. and don't suppress any feeling. Don't ignore any feeling because it is against biology. So if you have a problem with appetite and mood and energy, self-esteem, anger management, weight management, and problem with sex drive, there are chances that you are being impacted by the problems of any of these hormones, either dopamine, oxytocin, serotonin, or endorphin in your life. And that is going to affect your professional dental practice also. So these are the 4 hormones. As you know, dopamine is named as the reward hormone, and oxytocin is the trust hormone, and serotonin is the hormone of well-being, and endorphin helps you to create good habits or give you more willpower and to take more pain in your life. I'll come to that. Nowadays, all parents complain about the adolescent kids about their addiction into the social medias or the electronic gadgets. You know why? These students who are standing together, they are not talking to each other. They're not having a face-to-face relationship. They are talking to somebody sitting somewhere through the social media. Of course, at home also. Husband and wife and kid in the same sofa, but not talking to each other. They are talking and chatting with somebody else. Their college classmates, their group, that group and this group and all. Okay, why it is so? You know this sign, like sign? I'm going to tell you a little bit of the psychology part of it, the social media addiction. If you post something in your Facebook or in some social media, if you get a like, will you cry? No, you will not cry, right? You'll be happy with that. If you get a good like for some comment, some post or some video which you have presented over there. If you get a reward, it's a reward for you. It's like it's a reward for you. And the psychology behind selfie is also like this. You want reward. So dopamine stimulates you for reward stimulated behaviors. If a patient walks into your clinic and tells you that, doctor, I have a pain over here. I have done a root canal treatment from your clinic by your hand 10 years back and it is fine now. That's why I came here to consult you and driving 10 kilometers. I have a pain here. What will happen to you? You'll be so happy, right? My good old patient after 10 years. You may introduce this patient to your clinical staff. Look, my old patient. Okay, Mr. Babu, I have done a RCT for him 10 years back. And you'll be so happy with that. That day will be fine for you because you have got a reward. What happens if you get a reward? Dopamine will secrete. And if your wife gives you a good coffee, if you say that, Jana, your coffee is beautiful as you are, what will happen to her on that day? The whole day will be bright for her. So everybody looks for reward. So what happens with dopamine secretion? It motivates you. It gives you pleasure. Okay. So if you walk into your clinic, if you want to be happy, if you want to be motivated to say that I am a dental surgeon, if you want your staff to be motivated to say that I am working with Dr. Biju, you have to secrete their dopamines in their brain with your actions and behaviors. And at the same time, you have to take care of yourself also. So dopamine is so important. Dopamine anticipates some reward. So if you get some reward, it is going to secrete dopamine in your body and it is going to give you a very good feeling and it's going to stimulate your activities. Okay, when this mother helps this child to water the plant, if the mother scolds the child and say, "Hey, stand ahead, stand behind me. This is marigold. Your papa has brought this. Don't spoil that. I will do that. You are kids. Go ahead." What will be the feeling of the children? But this mother says that, "Yes, Chinnu, come here. You're a big boy. You hold this. You pour water like this, as your papa do." Then he feels that, "Yes, I am a big boy." And the next time, when whatever the mother asks the child to do, he will obey. He will obey. Okay, disobedience is not the discipline problem. It's a relationship problem. The parents has to take into mind. If your child is not obeying you, you always say that it's a discipline issue. It's not at all a discipline issue. It's an issue of the relationship between the parent and the child. That's another thing. Okay. What he is whispering into her ears now to secrete the dopamine? Darling, you're so beautiful. You're so beautiful. I am blessed to have you in my life like this. I will not have a life without you. What will happen to her? Dopamine secretion will be there. Okay? Even you cross the middle age, still you can smile with confidence if you have enough amount of dopamine in your body, if you get enough reward, and if you reward others, their dopamine can be increased. And even in the late phase of 80s, you'll be so happy to smile with confidence because you always reward her. She always rewards him for all the things they had in life. But we, especially we people, always try to curse others for their mistakes. You should train them and guide them. Of course, you can do that. You have the right to punish them. But at the same time, you should be aware to secrete, to make them secrete their dopamine by your words, your gifts, or your gestures or attitudes. Okay, so recognize others. Say if they have done a good work. If you have a junior doctor in your clinic coming for a practice, and if she does what we give in the first step is scaling. If she does a scaling, you go and see that she has done a good work. In the front of the patient, say that, yes, doctor, good job. What will happen? Her dopamine will start secreting, right? Like that, always try to appreciate all people who is around you so that your dopamine will be balanced and you will be happy and you will be able to smile with confidence. So give rewards. The annual celebration of your clinic opening, your birthday, your anniversaries, all things will have to be filled with rewards and gifts. Okay. In my clinic, every November 1st, we have the anniversary of our clinic because I have started my practice on November 1st, 1995. So November 1st means that's a festival day for my staff. Everybody will be in special dress. Everybody will be happy. And I'll be giving a gift for everyone on that day to all my staff and doctors. So that day, they'll be so happy only because they have enough and more dopamine. Because I recognize them for their service for the last years, for they have done for me on this day. And they know that. And of course, they are going to get an increment in the salary also. Even in the midst of this corona, I have done that. On November 1st, I have increased the salary of my staff. They told me, doctor, is just not necessary because the time is so tough, we know, but it is not necessary this year. We can make it next year. I said, no, we will do it. With pain, I can do that because it's a pleasure for me. Okay, fine. So dopamine is an important chemical messenger that is involved in memory, motivation, and attention. Okay. At the same time, it helps to regulate our movements. This very important, not a movement. I will come into that. I will come into dental practice, how the movement is important in dentistry, learning, and emotional responses. The right balance of this hormone is vital for both physical and mental well-being. You know, deficiency of dopamine causes Parkinson's disease and depression. Okay, that's another story. So, how can you identify that you have a dopamine deficiency? You will have a loss of balance, low energy, mood swings, muscle cramps, feeling of hopelessness, and low self-esteem. These are the main clinical symptoms which will be there in a person who is having less amount of dopamine in his body. So coming into dentistry, what is the role of this dopamine in dentistry? I told you about the movement and muscle balance. We are people doing endodontics, maybe our working length may be 80 millimeter. If you obturate with 19 millimeter, you know that what will happen on the next day. Patient will come with severe pain. 1 millimeter is so negligible in common life, but in dentistry, 1 millimeter is so important. So the working length is 18 millimeter and you have obturated for 20 millimeter or 90 millimeter, it is not right. So you have to be so specific and so precise. So the fingertips where you hold your GP points or your endomotor or your endodontic files has to go into the precise length, and your muscular movement should be so apt. If you have a lesser amount of dopamine in your life, in your body, if you are having low self-esteem, if you have low energy, if you are hopeless, then I can say that your observation will be deficient or overextended because you cannot focus. So being happy is very important for a dental surgeon for the precise treatment, especially in endodontics. Everything is important in dentistry. Each and every millimeter is important, especially in observations is very important. And focus is very important. When you go for the observation of a curved canal, when your rotary instrument goes there into the curved canal, you have to put your mind on the tip of the rotary instrument so that you can just trace the curvature of the canals. If you get a ledging somewhere there, you will be able to identify if you are so focused. Otherwise, you will have an instrument separation in the canal. So to practice better, you have to be happy because dopamine helps your muscles. I told you that dopamine decrease causes you Parkinson's, shivering, and out of balance, muscular issues. So your finger muscles and the body muscles and everything should be in good condition. And dopamine is so important for you that. So take care that if you want to practice well, this is very important. And see the mesiobuccal canal of this upper seven. This curved curvature, you may appreciate all these x-rays, but when you do this for your own patient, and if you can share this digital radiograph for your patient and you can give you a printout for your patient, they will appreciate all these works you have done. And of course, I say that I recommend all the dental surgeons to give up the report after your observation to the patient, because let them see what work you have done. The patient knows nothing. They just pay and go. Their money has gone, their pain has gone. That's all that they know. But just make them understand that how much important is in each and every millimeter is dentistry, and how much effort we have taken to obturate all this curved canal, and how much noble is dental profession in precise treatment on a human body. So let them appreciate all these things. Share your post-observation radiographs with your patient. But we are always focused on these things for happiness. We are always waiting for Saturday evening. Not everyone, some of them. Okay, so I would like to say that studies have found that dopamine levels may correlate with the addictive behaviors related to alcohol and other drugs. A regular use of drug can cause the brain to produce, absorb, and transmit less dopamine, which can further exacerbate the cycle of addiction. ശനിയാഴ്ച രണ്ടെണ്ണം വിട്ടാലേ ശരിയാവുള്ളൂ എന്ന് പറയുന്നതിന്റെ കാരണം ഞാൻ ഈ പറയുന്നത്. Understood? If you are addicted to alcohol or some other drugs, it will automatically decrease the natural production of dopamine in your body. You can't be happy without that. You are addicted to that only because you get some sort of happiness when you have such drugs. It is only because such drugs automatically decreases the production of dopamine in your body. Understood? I think that you can correlate to my sentences. I think you are catching up along with me now. So if you are in a habit of having some drugs or alcohol in your life, you are going to be addicted with that only because it is going to block the natural secretion of dopamine. That is going to affect your life and practice. Okay, when you see all these things, you'll be so happy because it is going to give you dopamine secretions. But without this, we have to go ahead. All the 6 7 days in the week, we have to be happy. Without this, we have to secrete the dopamine with the excellent work you do, with the excellent management you do in your profession and your personal life. So, as I told, life is a collection of moments. Knowing yourself is the beginning of all wisdom. So, understand yourself. Understand yourself first, and then learning about ourselves and about our practice and our human body. So you can increase your body's dopamine level by certain things. I'll just brush through that. Eating foods that are rich in protein, setting goals for yourself. You have a goal at the next year, 2021 December, I'm going to buy an embryonic microscope, okay? Or you are going to buy a laser in your clinic. You can have such goals that's going to deposit your dopamine. Eating foods that boost your level of magnesium, omega-3, vitamin D, and things like that. Exercise, therapeutic massage, meditation, keeping healthy gut biome, okay? Creating enough sleep, that's very important. Sleep well, that's very important for a dental surgeon. If you're active in late night in social medias and if you sleep very late, it is going to affect the melatonin hormone of your brain and it is going to damage a lot of organs in your body. So you should have a sound sleep. Okay. Number 2. So one is over. Dopamine is over. I will just brush through other 3 hormones and I will wind up. Number 2 is oxytocin. How oxytocin is going to work in the dental practice management of a dental surgeon? It is always told as a trust hormone and a love hormone because levels of oxytocin tend to increase during orgasm and hugging. Oxytocin is often released during childbirth and breastfeeding. The child has such an rapport or trust with the mother only because of the breast milk, through which she gives the oxytocin into the child. So oxytocin is a trust hormone. The trust is so high for any child towards the mother. It's only because of the oxytocin. So coming into dentistry, trust is very important. The trust between the patient and the doctor is very important. I can assure you that 75% of your practice, your patients, is walking into your clinic only because of the trust in you. Only because of the trust in you. The experience that they had previously from your clinic, which they have shared with other individuals. That is making them to walk into your clinic. They can have enough number of clinic around them, but still they are selecting you only because of this oxytocin, the trust that is developed in their body. So the dentist-patient relationship is very important and you should be aware of this oxytocin hormone. And COVID-19 has given a lot of learning for us in this. Mainly infection control protocols is very important. Always it is important, and in these days it's very important. When the patient comes to your clinic, when they see each and every protocol which you are adapting in your clinic, they say, wow, you are a different man. We have learned about rubber dam in the clinics and in the college days. But how much percentage of individual is practicing that? When I was putting rubber dam, one of my patients was asking me, you are putting a mask for me? Because mask is a very familiar term now. Mask is a very familiar term and it's a trusted name now. Because they say that with mask they are protected. So with that sentence, something happened in my brain and I said, of course, this is a professional mask put by a dentist. It is called as rubber dam. It isolates all the solutions, saliva, blood, whatever you have in your oral cavity. with the exterior atmosphere. So there will not be any contamination towards the exterior atmosphere. And your cavity will be so isolated, so sterile, so I can do a better work with that. And I have shown them all these things with the intraoral camera. I have displayed all these things in the camera, this screen in front of the dental chair. And so they are so happy with that. Okay, so now only they identified this is a very good practice. But our friends, they know things, but they are not very, very keen at introducing these sort of practice into their day-to-day dental practice. It improves the trust of the patient. So oxytocin increases emotional feeling and trust. The research has shown that it may be beneficial to people suffering from irritable bowel syndrome and anxiety. The trust is very important in the general health. So how you can boost your oxytocin level? Show affection to friends or family. Hug and kiss and touch. Touching maybe, limitation may be there now because of the corona, but you can hug your wife, okay, before you walk out to the clinic. If your spouse is not a dentist, before you go, say, hi darling, come here. Just give a hug or a kiss. There is no harm, no legal issues. You should have your own privacy, that's all. Give a hug and kiss her and go every day. That is going to improve the oxytocin level in both of you. Hug your kids and kiss them. It is going to improve the oxytocin level of your children. And get a body massage whenever possible. And share a meal, eat together. And do something nice for another person. It is going to improve your oxytocin level. But some patients may be having some financial issues now. They may be having some problems. They may be sharing such things in the clinic. Take care of them. You are earning money with many patients. Why can't you just take care of some friends, some patients, your good old patients who are suffering financially now? That improves the trust. Only because the oxytocin is improved in their body, because they say, oh, that doctor, that's my doctor. Even if I don't have money, I can walk into that clinic and I can have my treatment there because he is my dentist. That is oxytocin. And this is what happened in my clinic. But this photograph is not from my clinic, this is from a supermarket. One day, when the patient, after this, in this corona period, one day the patient sat in the dental chair for treatment. She put the mask in her lap. And after the treatment, when I asked to get her, automatically she stood up and I went to for washing to the wash basin. But suddenly I heard something. My chair side assistant was telling, no, don't take that. And the patient was about to take the mask which is fallen on the ground. So I just looked at what is happening now. And the staff immediately went there and took a new mask from the packet, from surgical mask, without my permission, because she doesn't need my permission for that. She understands the emotional bank balance is so strong. She took a surgical mask and gave to the patient and told that, wear this mask has gone into the floor. It may be dirty now and you may get an infection, and it is not wise to take this mask. And she plucked that and put into the waste bin. See the feeling of the patient and the feeling of the husband who is watching all things from the consultation table. That staff has done such a thing over there, has improved her oxytocin only because she believes they cares only, not only my teeth, they cares my life also. In this COVID scenario, when my mask was fallen down, which cost some rupees, they never mind that they took another new one and gave me free of cost and advised me not to take that, only to care my health. That's my doctor and that's my clinic. And that is going to improve the oxytocin level of your patient. Just think about such small things which is going to improve their trust, and that will going to improve their oxytocin level. You can have a sanitizer, but everybody takes the same sanitizer and sprays. Everybody catches on that. It is not recommended now. So keep a automatic sanitizing machine. Nobody touches. It's very easy. Everybody is happy. Their trust is more. Okay. Have a this monitor, temperature monitor, it's fine. Hug your wife whenever possible. Hug your kids whenever possible. It's going to increase the oxytocin. And the grandma always hugs the grandchildren. That's why they are so connected between the grandparents and the grandchildren. Okay, of course, these situations are very necessary in our life. Third one, serotonin. Serotonin is the hormone that is mainly responsible for stabilizing our feelings of well-being and happiness. We should feel happy, and feeling of well-being is achieved only by serotonin hormone. So reduced levels of serotonin in the body can lead to anxiety disorders, especially nowadays, corona period. Social anxiety disorder, PTSD, post-traumatic stress disorder. In Kerala, we had flood in August 2018. And again, we had flood in 2019. And we were expecting flood in 2020 also, August. When August comes, every Keralites were afraid because of the PTSD, post-traumatic stress disorder. In August, we are going to face a flood. Okay, and somebody sneezes now. Everybody is worried. Okay, when you hear the word positive, it is very dangerous now. And before Corona, positive was a positive word. Now positive is a negative word. Okay. Obsessive compulsive disorder, panic disorder, phobias, generalized anxiety, everything comes when you have serotonin decreased level in your body. So consume food that are rich in tryptophan, because tryptophan is an amino acid that can be converted into this serotonin and melatonin. Melatonin is the hormone which I told you, which is controlling your sleep and health. So drink milk, have some corn and other forms of carbohydrates. Okay, don't have too much of carbohydrates. It's going to make you fatty. So have a little bit of carbohydrates which you like, and your serotonin levels will be increased. So how to boost your serotonin? Aerobic exercise is very important. Running, brisk walking, swimming and cycling. You have to do that. Even you work for 10 hours, find time for some aerobic exercise from your home or from your fitness center. It's a must. You have to do that. Otherwise, your happy hormones will go down and it is going to affect your practice. You know, this doctor, the vice president of IDA Kerala, doctor always do this morning cycling along with his family. See how happy he is, how happy they are. These people are our role models. Okay, the vice president of IDA Kerala. And this is another vice president of IDA Kerala, is along with his kids. Okay, so having such aerobic exercises, cyclings and running and things like that help you a lot to improve your happy hormones. And have a nice morning walk or evening walk whenever possible with your family. Go to park, have games, have fun. It is going to boost your hormones. So have happy thoughts, thinking about positive memories, being grateful to others. It improves your serotonin. You always think negative things. Oh, my dentistry. Oh, fed up. Lot of problems, lot of issues, risky. Don't think like that. Dentistry is a noble profession. Nobody else can walk in and start a dental clinic tomorrow. You have to take pain at least for 5 years and another 3 years for your building your hand for practice or going for a post-graduation. 8 years you are spent on this 32 teeth and soft tissues and oral cavity to treat a patient, right? You're learning of the whole body, the whole human life. It is a noble thing. Nobody else can do that. So have happy thoughts about dentistry. Think about positively and be grateful to everything what you have now. That will improve your serotonin. Last thing, the endorphin hormone. That is the natural painkiller. You know morphine? Morphine is a narcotic painkiller which is given to the poor, suffering, painful, cancerous patients. And that is morphine, you know that, narcotic analgesic. Now, morphine functions by acting on the opioid receptor in the brain. Endorphin is an endogenic morphine, you can call it like that. Endogenic morphine, the morphine which is produced inside your body. Okay, these are chemicals that can help you to cope up with stress and pain. You can take enough pain in your life. That is your body's natural painkiller. You should be aware about that in your dental practice, because this will help you to move forward. Even what all things you have, if you have enough endorphin in your body, you will take pain. Otherwise, you will always keep a safer side of your practice. If you take pain for your patients, they will take pain to attend you, to visit your clinic, and to have practice from you. If you have lesser endorphin, at the end of the day, you will be sitting like this. Tired, exhausted, whatever blessing you had the day, nothing is going to work because your endorphin level is so low. Or you'll be sitting like this in the dental clinic. So exhausted, fatigued, tired, depressed, you will not be happy. But if you have enough pain, managing a crying patient in the clinic beautifully, and just sending the patient like this from the clinic means it is going to boost your endorphin level, the happiness hormones inside you. And it's a ladder for you to better practice tomorrow. Your confidence will increase. Otherwise, when a baby comes into the clinic, oh, pedodontist, you go there. Pedo patient, go there. No, 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 no. You are going to escape from this because you are not ready to implement what you have studied in your life in patient management and shaping the patient. You are not going to take the pain, but the pain the parent is having, the baby has not slept yesterday night. You are not going to take the pain because your endorphin level is less. Be aware of that. Then you will try to take more pain in your practice. You'll be always calm and cool and happy to explain things to your patients. And at the end of the day, and at the end of your dental practice, you can have a selfie like this and post in your group, because everybody is happy. Every practice is over, and the doctor, the assistant staff, and the specialist, the associates, everybody is happy. Let us have a coffee. Let us have a snap. It is a wonderful thing because the dose is correct here. Dopamine, oxytocin, serotonin, and endorphin is in the maximum level. It is achieved in the best way. And that's the owner of the clinic or the manager of the clinic. We should be aware of these things, that we should always keep and titrate the dose, these hormones in others who are working along with us and living along with us. So apart from being a painkiller, it can also help us to focus. When you open an endodontic canal, the access cavity, the focus is very important. When you put a bracket, the focus is very important. When you do a composite filling, the focus is very important. Even when you give an LA, the focus is very important. So it will improve your focus. If you're happy, you can focus well. To improve your overall mood, you will be happy. At the end of the day, you'll be so cheerful and happy. So endorphin can be secreted through aromatherapy. Smell is very important. Especially, I would like to share with my friends. Hello, I'm sorry. Dr. Adina, can you hear me now?
Yes, yes, yes.
Something happened?
Yeah.
You're
audible now. It's fine.
It's okay, it's okay.
It's okay. Only 5 minutes more.
Yeah, you are audible. Please continue.
Okay, fine. So, smell is very important in life. Having perfumes, having good smell. But always when you open the endodontic canal, when the necrotic canal, you have a necrotic smell inside the clinic. We are sitting in the clinic and we may not be aware about that. But when the new patient walks into the clinic, they hold their face like this. So always try to keep the atmosphere, the smell of the clinic in a better way. And people always try to put this, what I can say, air freshness with synthetic aromas in that. It is not good for health, because you are sitting every day in the clinic and you are inhaling that. And more than that, try to install a good quality air purifier or filter in your clinic, that will help you a lot. That will help you a lot. All these necrotic smell, all other bad smells will be absorbed by that. That the only thing that you should buy a good quality one. And you should laugh and talk inside the clinic to your patients, bystanders, and to your subordinates. Have a healthy diet, have enough sunshine, and do have a positive behavior. That's going to help you. Okay. Then benefits of endorphin is it's going to reduce your stress and anxiety, and it is going to build your self-esteem. It is going to manage your body weight effectively. So first thing what you have to do is that my sincere request to all the friends who are hearing me now, that you have to love yourself. Being a dentist, love yourself first. Believe that we are in a very good, noble profession in the world. And love that, and love your patient, love your profession. You can't love others if you don't love yourself. നിങ്ങൾ സ്വന്തത്തെ സ്നേഹിക്കാതെ മറ്റുള്ളവരെ സ്നേഹിക്കാൻ പറ്റൂല എന്നാണ്. അതുകൊണ്ട് start loving yourself first. Then you can start loving others. So signs and symptoms of low endorphin levels, proclivity to addictions. When the endorphin is less, Saturday night will be more important for you. Trouble in sleeping will be there. Moodiness will be there. Frequent display of impulsive behavior will be there. You will not be able to control yourself. You will be afraid of yourself. You don't know when your temper will lose. That is only because of the decreased level of endorphin in your body. So how to boost this endorphin? Exercise, regular body exercise triggers a flood of endorphin that can combat depression and anxiety in your life. So my dear dental friends, my dear dentists, I request all of you to have a regular body exercise that will improve. So you can have it at your home, or you can go to any fitness center.
Okay. Mudi kodi. Kodila.
Adina doctor, somebody is talking there. Ask them to mute, please. Okay, fine. Then you can go to some nearby good quality fitness center, spend 1 hour there. You will have a good dental practice. You will have a good family life. You will have a good social life. So focus on having enough physical exercise, and that's very important for the general health and very important in dental practice management. Or you can have simple tools like this hula hoops, which that the kids can have, the whole family can train with that. It's very cheap instrument which you can get from any sports shop. Get trained for that. My kids always do that because it's a very beautiful thing, very simple thing which shapes your body and mind and your hormones. This is hula hoops. You can buy it from Amazon or from this sports shop. You can have a lot of YouTube videos. It's available about hula hoops. They will train you by videos and it will help you. It's a very simple thing. If you can try that, it is going to help your happy hormones. Okay. And spicy foods, special foods which you like, that will improve your hormones. And those people who are more related to music, who love music, that music will improve their endorphin hormones in their body. And that's why our Dasetan is like this, always happy and cheerful. Our Chitrechi is always happy and cheerful and lovable because her endorphin level is so high. You know that she is now having social activities where she always takes pain to care the poor and the needy now. Because she is a great singer, but the endorphin level in Chitra is making her a complete individual now. That's only because of the endorphin hormone. And like the dentist who are having enough amount of endorphin level will become a complete man. But that's what I would like to say. So playing music, eating spicy food, not too much spicy food, means the food which you like, and having sex can support endorphin release. If you do all these things according to the rules and regulations of the nation and in the positive way. Okay. And smiling is connected with self-esteem, confidence, and defeating depression and anxiety. So just smile. And we are people who make others smile, right? So first of all, you have to smile with confidence, then make others smile. Okay, that's a very important thing. Smiling makes people happy. And the smile designing people in the world is dentists. Nobody else can do that. Even apart from dental tissues, Dentists can test the facial tissues, even all the wrinkles, all the marks, facelifting. All these things can be done by a dentist nowadays. And such things are coming up. A new facelift of dentistry is coming up. That is another topic. I'm not going into that, but we can make people smile more beautifully and with more confidence. And for that, first of all, we should smile with confidence. So that's all with smile with confidence. So my last question is, how important are the hormones of happiness is for you? How important is for you the happy hormones? Can you tell when you are going to undertake the activities that stimulate your happy hormones? Just ask yourself, when are you going to undertake these activities which I was telling you for the last, oh my God, it is 12:30 now. So 1.5 hours I have spent with you now. So let me ask you, just ask yourself to your mind, when are you going to undertake all these activities? At least one from this. I am so sure that I can guarantee you that it is going to improve your quality of personal life, social life, and professional life. If you integrate things in the right way, in the right place, at the right time, so that you will be so confident to smile nicely. That's smiling with confidence. So don't postpone it for tomorrow. Yesterday is past. Tomorrow is yet to come. Start it today, my dear friends. Start it now. You can say that you can see a beautiful change in your life. So it will give a compassionate interconnectedness in your life. With your family, with your people, and everybody around you will be so happy, and you will be proud enough to say that I am a dentist, and you will be so confident to smile with confidence. So with these, all our activities have a paradigm shift from the doing mode into the being mode. Okay. You're doing endodontics, you're doing orthodontics, exodontia, everything. Being, that is robotic dentistry. What I was talking is switch over from the robotic dentistry, from the doing mode into the being mode. Being a dentist, being a husband, being a father, being the son, being the doctor is more important than doing the job of the husband, doing the job of the father, doing the job of the dentist. Doing mode and being mode. Learn more about that. That's another topic for me from the distress management area. I will talk more on that in another situation. So it's just for your reference. Switch over to being mode. After all, we are human beings, right? We are human beings. We are not robots. So all these academic things which I have shared with you about the hormones and about the emotional bank account will give you a paradigm shift in your practice and personal life from the doing mode into a being mode. And being mode is something beautiful because we will be in a moment-to-moment mindful situation where we enjoy the life, because life is a collection of moments and each moment will be beautiful. And that is something great. You can do many jobs wonderfully and beautifully. And the business of life is not breathing, eating, and sleeping. It is to find out who you really are. It is to find out who you really are. Find out that who you really are, what capacity you have, how blessed you are. Apart from dentistry, your management skills should grow up so that you will have a nice practice. So that is personal transformation. I was not sharing anything with you. I was not giving you any information. I was purposefully trying for transformation in you, not to pour it with you information, because information, when applied, gives you transformation. So I hope and pray that all these things will give you a personal transformation, and it will give you a confidence to smile with confidence. That's all. If you have any doubts, anything to share, you can have my mobile number from the Attingal branch president, secretary, or anybody have. For the information, those people who are in live with YouTube or Facebook, you can share that. My mobile number, WhatsApp number is 944 72 68913. I'll repeat, 944 72 68913. Or you can mail me to mydentist1995@gmail.com. My email address is mydentist1995. That's a year where I have started my clinical practice @gmail.com. Just share your views, your opinion, any feedbacks which you have, or any points which you can pour in so that I can improve my presentation or my academic level so that you can help me with that. So just mail me to mydentist1995 @gmail.com with these, and with a heartful of basket full of thanks to the Idea Tingle brands and to all the participants who listened to me for this over 1.5 hour in this topic of excellence in clinical management, the topic smiling with confidence. I thank you all for all kind listening and for everything. With these words, let me wind up this topic. Thank you once again. Goodbye.
Thank you very much, Dr. Abdul-Latheef. Actually, words are not enough to express our gratitude. Actually, what we expected, you are far beyond that. What I can say, actually, like one of our participants last commented, it's really an eye-opener for all of us, all of our practitioners, even a human being, it's a eye-opener. I can say, നമ്മൾ ഒരു ദൃശ്യം 2 ഇപ്പൊ ഒരു റീസെന്റ് ടൈംസിൽ പറയുകയാണെങ്കിൽ അതിന്റെ ഒരു ലാസ്റ്റ് 40 മിനിറ്റ് എങ്ങനെ കണ്ടുകൊണ്ടിരിക്കുക, അതുപോലെ ഒരു പ്രതീതി എനിക്ക് തോന്നിയത്. നമ്മൾ എന്ത് എക്സ്പെക്ട് ചെയ്യുന്നു, യു ആർ ഫാർ ബിയോണ്ട് ദാറ്റ്. നമ്മളെ എക്സ്പെക്ട് ചെയ്യുന്നതിനെക്കാട്ടിയും വളരെ 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 മുകളിലായിരുന്നു ഇദ്ദേഹത്തിന്റെ ഓരോ സ്ലൈഡും, ഇദ്ദേഹത്തിന്റെ ആ ടോക്കിങ്ങും. ഈവൻ ഐ വാസ് ഡിസ്കസിങ് വിത്ത് ഡോക്ടർ ബിജു, അദ്ദേഹത്തിന്റെ ആ ഒരു വോയിസ് മോഡുലേഷൻ, ആ ഒരു ഈച്ച് ആൻഡ് എവറി സ്ലൈഡ്, ഹൗ യു ആർ പ്രസന്റിങ്, റിയലി ഹാറ്റ്സ് ഓഫ്, റിയലി ഹാറ്റ്സ് ഓഫ്. And thank you very much. Even words are not enough to express our gratitude towards you. And I invite the young lady behind scenes, Dr. Adina, to share a few words with us.
Good afternoon, all. Actually, I must say it's a very happy moment for me that I could start our CD session with this stress-relieving and motivating session. When Dr. Biju said about this excellent faculty, I never expected this much from the sir. Thank you, sir. Thank you so much. It was a I must say it needs a very great applause from everyone. Thank you, sir. Thank you so much.
Dr. Biju is there, means just share a few words with us.
Yes, yeah. I am also the young generations. I'm using the young generations Malayalam word "polichu." Actually, it is superb.
Excellent.
And, unlike Adina, I expected this. That is the difference. Because from our college days, student days, I was hearing his speeches. Even on our admission day, he delivered a speech. Some among the students newly joined were invited, and he delivered an excellent speech there. Then day one onwards, I was hearing his word, and this one was expected. It as a good talk, but this talk was of a different level. When we expected the practice management, like the influence or relations and such things, was expected. And he was talking about hormones and its influence and that. And it's excellent. And thank you, Latheef, and I'm proud of you. Being a classmate of yours. Thank you.
Thank you, Viju.
Thank you, Dr. Biju. And I next I invite one of our senior most member. നമുക്ക് കണ്ടു കഴിഞ്ഞാൽ നമ്മുടെ റീസെന്റ് ആയിട്ട് ഒരുപാട് വിവാദങ്ങളിലൂടെ പോയ ഒരു IAS ഓഫീസർ ആണെന്നൊക്കെ തോന്നും, പക്ഷെ അല്ല. വൺ ഓഫ് അവർ സീനിയർ മോസ്റ്റ് മെമ്പർ ഡോക്ടർ അനിൽകുമാർ ഡി, അവർ ആക്ടിംഗ് സെക്രട്ടറി ആൻഡ് നമ്മുടെ പേഴ്സണൽ അഹങ്കാരമൊക്കെ എന്ന് പറയാവുന്ന ഒരു വ്യക്തി, ഡോക്ടർ അനിൽകുമാർ ഡി. ഐ ഇൻവൈറ്റ് ഹിം ടു tell with the art of thanks. Yeah, Shivashankar. Our one and only Shivashankar. Please.
Good afternoon. Dr. Abdul-Latheef, നമ്മുടെ ബിജു നായരുടെ ക്ലാസ്മേറ്റ് ആണെന്ന് പറഞ്ഞപ്പോൾ തന്നെ ഇത്രയൊക്കെ നമ്മൾ പ്രതീക്ഷിച്ചതാണ്. ആറ്റിങ്ങൽ ബ്രാഞ്ചിനെ കൊണ്ടു നടക്കുന്നതിൽ ഒരു ഡോക്ടർ അതുപോലെ വഴി അബ്ദുൽ-ലത്തീഫ് നല്ലൊരു നമുക്ക് തന്നത്. ഞാൻ അദ്ദേഹം CD പ്രോഗ്രാം അറ്റൻഡ് ചെയ്ത് ഇപ്പോൾ സൂം മീറ്റിംഗ് ആണ് ഇതിൽ തന്നെ അറ്റൻഡ് ചെയ്ത് വരുന്ന നമ്മുടെ പാർട്ടിസിപ്പൻസ് പാർട്ടിസിപ്പൻസ് ഉണ്ട്. എല്ലാ പാർട്ടിസിപ്പൻസിനും ആക്ടിംഗ് ബ്രാഞ്ചിന്റെ പേരിൽ ഞാൻ നന്ദി
I think his voice is not clear.
It's breaking. The sound is breaking.
Yeah. Thank you, Dr. Anil Kumar D, for delivering the art of thanks. And hope to meet Dr. Abdul-Latheef very soon with a very very eye-opening program. Thank you, Dr. very much.
Okay, thank you very much. Let us conclude.
Yes, sir.
Let us conclude.
Thank you.
Okay.
Thank you very much.
My sincere request to all friends that apply the information into your life and practice. That's all.
Sure.
Thank
you, sir.
Thank you
very
so much.
Hope to meet you soon. Bye-bye.
Okay, thank
Bye-bye.
you. Yeah.
Thank you, sir. Thank you. Thank you, sir. Thank you.
ഉണ്ടായിരുന്നല്ലേ?
A lot of our senior members I can see now.
Yes,
Alex
we do
Sir,
have Dr. Rajagopal.
Yeah.
പറയാൻ
Dr. Rajesh Ramachandran Nair, നമ്മുടെ
ഉണ്ടായിരുന്നു.
Yes, he's there. He's there.
നമ്മുടെ ക്ലാസ്മേറ്റ് ഞങ്ങളുടെ ക്ലാസ്മേറ്റ് രാജേഷ്
അതെ അദ്ദേഹത്തിന്
മാവേലിക്കര ബ്രാഞ്ച് പ്രസിഡന്റ്
അതെ ഞാൻ ഇപ്പോഴാണ് കണ്ടത്. ഡോക്ടർ രാജേഷ്, ഇഫ് യു ആർ ദേർ, സോറി and hi to you. And lot of senior members are there. Thank you very much. Adina, please
Yes, sir.
conclude.